Okay, welcome back. If you have just joined us, we have this story, very disturbing. The Nigerian Medical Association, NMA, says only about 24,000 medical doctors qualified are having to deal with more than 200 million of us in this country, and that's something troubling. Jide, so you are at this point in time, you are wondering what the state and federal governments can do.
Yeah, there's a lot that they can do. We need to produce more doctors and fund those medical colleges. India has 479 medical schools, and every year the average intake is 67,000 medical students. Entering for the MBBS.
Yeah.
So this has helped them to meet that WHO ratio of doctor to the population. And I know that we can get there too if we work hard. Let's build more medical centers, build more medical schools, to continue to produce enough to take care of our population and do our best to keep the ones that are here. There should be incentives for medical doctors to remain, to work in the hinterland, in the rural areas. I remember that a state like Jigawa tried it some years back. Just give them some incentives, and you start to do that for the junior doctors, for example. Level of NYC, those who want to stay in the state and work, you give them the incentive to make them remain in that state and work. And those who want to stay in the hinterland and work there, you also give them the incentive.
Essentially,
and provide the tools.
The work environment must improve.
Yes, even quality tools that you work with is part of work environment. Provide what they need to do the work. That will encourage a good number of them to stay.
Definitely. It's only natural to ask at this point, do you think these emigrations are for money's sake?
I think Dr. Titoju, answered that question, elaborately. Specifically, he talked about career progression. Say, look, if I'm a medical doctor and I don't have access to facilities, I don't have access to modern development in my field, I could be on my way out. I would be seen as an old school doctor when my peers in other parts of the world are moving up. We have this case of one hospital in a part of the north where we conducted this research. In that hospital, there was only one urologist. He was the only urologist attending to every urinary tract infection in that hospital.
Wow.
So you know what happened? He just left.
Pressure.
He left. Not just because of pressure, but he felt he was not enjoying, job satisfaction. He had to go to other parts of the world where he has access to facilities for investigation, where he could rub minds with those who are in the same field with him. So it's not just a remuneration, but then remuneration is part of it. There's trust deficit between health workers and government. Yes. We spoke to a medical doctor who said, look, all the promises that government has made to us, about hazard allowance, special allowance, government never kept those promises. And then even the minimum wage, the way it was implemented in their own state, its own state, was laughable. So, you see this half-heartedness, lack of political will in facing, the issues. And like Dr. Tito, you said, I want to also emphasize that if government knows, and it's becoming clear to us that government knows that it can't fund health, it's good for us to sit down and say, what else should we do?
Yeah.
Because if you can't make health available free to Nigerians, then why don't you now sit together with all stakeholders? As this thing cannot be free, how do we implement insurance? How can we get foundation, non-government organizations to come in? How can we ask companies to come in? Because in Nigeria, it's a signatory to 2001 declaration, Abuja Declaration, which was to say 15% of the budget should be dedicated to health. It never happened. It never happened. Because even Nigeria's budget is not enough for any, like you were talking about, Australia budgeting $100 billion. Nigeria's budget for 2023 is just $43 billion. When we hear 20 trillion, it amounts to only $43 billion, which is not up to what some
you are the one converting it.
Of course, I mean, we need to convert it to know where we stand. Because other countries, even like South Africa, has about $101 billion as its budget, and something about 50 million persons. So you see, I don't think we are realistic, in our plans, and that is why I'm advocating that we must ensure that we have data, for making policies.
Yeah.
If we have the data, we know that, look, what we are planning for Nigeria is not realistic. We now say, okay, based on this data, what should we do? And we have to face the fact.
Jide, you talked, even if in passing, about medical schools in India. Let's talk about our country. There are medical schools here.
Yes.
So are we thinking about equipping them and upping the ante in terms of training?
That's what we should be doing. I still believe that we produce quality medical professionals here, because when they go to the UK, the US, they still sit for some exams there, before they can be qualified to practice, and they excel. So if they are excelling in those places and they are being licensed to practice, it must be because they are good enough. So the medical schools here must be good enough for people to write exams, to work abroad, and for them to succeed. It means that those schools are good. I know how grueling the process can be to train a doctor here. And that's why it's painful that despite all that the country spends to train the doctor, we can't even keep them. They all want to go.
What a
and
shame.
even nurses too, and midwives, they're also living in droves. The level of emigration of doctors from Nigeria is the highest in Africa. It's really troubling. Highest in Africa, and I think the third highest in the world. That's nurses. So it's not even doctors alone that are living.
Is it too late?
It's not.
In one sentence.
No, it's not too late, but I emphasize the need for us to engage in research. Like this research that we did, the partnership with DRPC, is funded by Bill and Melinda Gates, and, if Nigerians were, putting money into research, we'll get more details, more information that will help us to do proper planning.
Gideon, and to you, is it too late to start something new?
No, it's not too late. This is the best time to begin to address this problem. If we wait until it's too late, then it will be bad. We need to begin to address this problem now, and this is not an insurmountable problem.